A mix of familiar faces and people who are here on a routine or annual basis. We have a great agenda, and I hope that at the end of the day, you will walk away energized with additional ideas and new connections that you can build on in your work. This morning, we welcome Greg Gard from University of Wisconsin-Madison men's basketball coach. Greg and his wife, Michelle, launched the Guarding Against Cancer initiative to raise funds for awareness and cancer research at the UW-Carbone Cancer Center and cancer care throughout Wisconsin. They were inspired to start Guarding Against Cancer to honor Greg's father, Len Gard, who passed away in 2015 following a 6-month battle with cancer. They decided it was a fitting focus to fight cancer across Wisconsin because Len was so committed to helping locally first and foremost. Guarding Against Cancer is a perfect example of building connections to raise awareness and reduce the burden of cancer in Wisconsin. Please help me in welcoming Greg Gard. Thank you.
Say this technology things, you have to catch on. Gets confused as we- There we go. Oh, there it is. Oh, I got it. Gotta get my readers out here after I cross the 50-yard line. Those that know have been there know what I'm talking about. But good morning to everyone. Obviously, we're in the start of our season. Actually, today will be day 3 of our practices. So we're at the very, I guess, starting line, so to speak. But I want to take a few moments this morning to maybe give you some insight into Guarding Against Cancer, my story, along with my family story. So first of all, welcome to everyone this morning. I know that full well that some of you have personally heard our cancer story, understand the path we have walked, and the drive behind our Guarding Against Cancer mission. While others here today maybe are listening to me speak about this for the very first time, I'm sure many of you are here today curious to hear about what GAC is all about. So here really is the simple Cliff Notes description. GAC's mission is to provide funding for prevention and patient care at the local grassroots level across the state, while still funding research opportunities at one of the nation's best cancer centers in Madison. But this journey over the past 8 years has taken us well beyond any mission statement. It's become the part of our fabric as we connect with so many across the state of Wisconsin. What we've learned is that everyone has 2 things in common, and I'm sure all of you here today can relate to this. We've all been touched by cancer in some way, shape, or form, and we all want to help. I often get asked in coaching, what's your why? And my why 35 years ago was to help young kids as I started in junior high. We all have our why in terms of our cancer passions as well. Maybe a member of your family, a friend, or a colleague is living with a cancer diagnosis. Maybe you're currently fighting the disease yourself, or maybe you've had a loved one pass away, or have helped care for, or driven a neighbor for treatments. Unfortunately, cancer is all around us, and we need to continue to unite to find more productive research, better treatment options, and a higher quality of care for patients fighting this dreaded disease. There are so many people that need our help. The cancer stories that we've heard since starting our GAC initiative are heart-wrenching, but within the pain, we found an amazing silver lining. And that silver lining has been people's compassion and overwhelming willingness to help others. That compassion is what has drawn us all together today and drives our Guarding Against Cancer Foundation. As Paul mentioned, when my dad Glenn was diagnosed with glioblastoma, a rare form of brain cancer, in May of 2015. We were hoping time would be our friend. In the quickly spinning world of college basketball, We often live in the perceived bubble of invincibility. You're always looking for an edge. There's a way somewhere, someplace, somehow, that if you plan well, prepare intelligently, work hard, and play well, your teams will beat the likes of Michigan State, Kentucky, North Carolina, or Villanova. That feeling of invincibility is programmed in your DNA as a coach. It's almost a mandated prerequisite to survive the roller coaster of emotions you experience through the rigors of a long season. Far too often, though, cancer doesn't care about invincibility. It often works on its own timeline of when it appears, how strong of a grip it comes with, and also if or when it reappears. Cancer doesn't discriminate, nor care about who or what is left in its destructive path. Unfortunately, during the journey with my dad, we learned even with the best medical care, combined with his unrelenting personal fight, we couldn't find a way to win. And the invincible mindset we have professionally at the Soul Center in Madison was being crushed by the harsh reality of his terminal path. He passed away just 6 short months following his diagnosis, a timeline his family and friends wish could have extended much, much longer. Ironically, a few months following my dad's passing, I was named the permanent head coach at Wisconsin. And as my wife, Michelle, and I sat down and reflected on the avalanche of events we had just experienced, we asked ourselves one question. How are we going to be able to use our platform, our experiences, our resources, and our voices to help others in the fight against cancer? With both of our paths, personally, educationally, and professionally, never wandering beyond the borders of Wisconsin, it made perfect sense and aligned harmoniously with our mission of helping at home first and foremost, making our vision a complete slam dunk understanding and appreciation that while my dad thought globally, he truly believed in supporting and acting locally. It became crystal clear that we wanted to have our most tangible impact felt right here in Wisconsin. So in December of 2016, on a typical Wisconsin wintry night, I almost went in the ditch on the way to the actual press conference about it. We officially launched Guarding Against Cancer. What we didn't know at the time was how quickly our campaign would flourish. It has been amazing to watch what a group of people from almost every corner of the state can do when hearts, minds, and financial resources come together for a common cause. The past 8 years has seen our GAC team raise over $9 million that is all dedicated to the fight against cancer through a variety of research and patient care right here in Wisconsin. We have funded organizations in Menominee, Oshkosh, Wausau, Wisconsin Dells, La Crosse, Janesville, Whitewater, Eau Claire, and Stevens Point, and obviously tried to help immensely at the Carbone Center in Madison with millions going to research. And even next Tuesday night, we'll be in River Falls for our 2024 outreach event, intending to help the people of Dunn, Pierce, and St. Croix counties. Our mission has supported such necessities as prescription medicines, expanded screenings and free and reduced clinics, cold cap treatments to reduce hair loss, transportation to appointments, massage therapy, music therapy, gas cards, and support for families with pediatric patients, just to name a few. While the funds raised have been phenomenal and are a humbling testament to the graciousness and caring spirits of Wisconsinites, our mission lies much deeper than the total amount of dollars raised. Our personal story has become a magnet, a lightning rod, if you will, for others experiencing a similar journey. We've visited and accepted GAC donations from individuals, families, schools, and basketball teams. Funds have been raised through ESPN's Infinity Challenge, iHeartRadio's Paying for Points program, 5K runs and walks, golf outings, and we've even been fortunate enough to host our annual signature event each May at the Kohl Center, which has raised on average about $1 million per year for the mission of attacking cancer and helping patients in a variety of ways throughout the Badger State. Just like many of you in here today, we have listened to personal stories of cancer. We've hugged fighters and survivors in Madison Square Garden, met with parents in Australia who lost their own child to cancer, held hands bedside at hospitals, and tearfully visited those placed in hospice who unfortunately were in the twilight of their own personal battle with cancer. Each and every one of these individuals have inspired us with their courage and unrelenting fight. If you've ever watched what a cancer patient has to physically and emotionally go through, you know exactly what I mean. Standing here today and helping to continue to spearhead our mission throughout the state is quite elementary compared to the havoc and destruction cancer can place upon its victims and surrounding loved ones. So why do I coach? I coach to help others, but the passion for all of us and all of us shared together, a passion for helping others, just like the one you have. I'm part-time at this in the cancer fight. You're full-time. While we all know we've got so much more to accomplish down the road, we've accomplished and we've come so far. Your commitment, your dedication, your passion for helping others does not go unnoticed or unappreciated. Thank you for all you do. You're at the grassroots of our state's cancer fight. All of you help make Wisconsin a healthier, better place to live. Have an awesome day. Thanks.
If you feel like you could go out there and make some 3-point shots. Go back there. Go Badgers, yeah, go Badgers. Okay, all of us in the bar are behind the team. Well, thank you, Coach Gard, for your inspiring words and accomplishments with fighting against cancer. We were fortunate to have you in lacrosse. We were talking about that just before the beginning of the meeting, maybe 2018, 2019. And you say BC of lacrosse before COVID. So our next event or presentation is built around the Community and Cancer Science Network and their collaborative work groups based at the Medical College of Wisconsin. The premise of the CCSN collaborative work groups is that bringing together many different perspectives will help everyone understand cancer disparities differently and help us all find better solutions. The work groups focus on breast cancer and lung cancer in Wisconsin, and I'd like to introduce the members of the panel. So here are the panelists, and I'll introduce them one by one. Our first panelist is Dr. Stacy Young. Dr. Young is a professor and associate director for community outreach and engagement at MCW Cancer Center. In her leadership role, she is charged with advancing the institution's strategic mission of excellence in community engagement and promoting health. Our second panelist is Phyllis Holder. Phyllis is filled with gratitude and joy to be a mother, grandmother, and a 19-year breast cancer victor. She is a retired nursing educator and Army Reserve Corps Reserve Nurse Corps veteran, and a National Breast Cancer Coalition Project lead graduate and former Wisconsin Breast Cancer Coalition director. She served for many years as a Sisters Network Incorporated National Breast Cancer Organization chapter president, and is the founder and executive director of Sisters for a Cure Incorporated. Let's welcome Phyllis. And finally, our third panelist is Dr. Chandler Cortina. Dr. Cortina is a breast surgical oncologist and researcher at Freighter and Medical College of Wisconsin and the MCW Cancer Center. His research focuses on understanding how gender-affirming care may alter cancer risk screening practices and treatment recommendations for gender-diverse populations, as well as how novel systemic therapies impact surgical decision-making and surgical outcomes for patients with breast cancer. Let's welcome Dr. Cortina.
I don't know. I hear the tap, but I. Yes, there you go.
All right, thank you.
We're just. We're mixing things up a bit, everybody.
Yeah.
Good morning, everyone. My name is Stacy Young. We're really excited to talk about the collaborative work groups, an initiative of the Community and Cancer Science Network at the Medical College of Wisconsin. Your agenda says it's a panel discussion, and it is, but it's a little bit of a different style. You might be expecting panelists to sit up at the front behind the tables and have the microphones, but we want to be present with everyone here just as we're present in our work group. So you'll see us moving around, asking questions, keeps everybody alert as you have to sort of move around as we move around. So Phyllis will start by guiding us through a bit of an open-ended discussion around collaboration, what that means, how you all think about it. We use the word quite a bit, but not necessarily to assume that everyone has the same definition or thought around what collaboration actually is or how you've utilized that in your own work or in your life. So Phyllis will guide us through that. I'll talk a little bit more about CCSN and the collaborative work groups. And then Phyllis and Dr. Cortina will talk about their own experiences in the groups. So I'm not sure how it will work. It looks like there's a recording, so I don't know if the camera's going to be able to follow us, but hopefully the audio will still pick up. Okay, thanks.
Well,
Please, Phyllis, go ahead.
Thank you. I'll pick that.
Oh, yes, sorry.
But so, we didn't factor in recording, so but they'll try their best to catch us. But good morning again. Good morning. Good morning. I want to tell you a little bit about myself, but I'm gonna save that for last, okay? And you probably not already, and right now, I'm more of a full-time grandmother who's proud to say that now twice, I provided childcare for my granddaughters, and I have one under 2 now. But in the Linda process so far, my provision of childcare has allowed her parents to put down payment on the house. Okay. That quite a bit. Because I think I got jaded. You know, I was diagnosed 19 years ago. And even before that, I happened home. Dr. Underwood and Dr. Walker and their community outreach that involved breakfasts and different educational opportunities stations, maybe at the Italian Community Center or, you know, somewhere else in the community. And I was well aware of Black women who needed to hear what they were saying. Not that you all don't need to hear it, but the women who were affected needed to hear it more. So I would transport people to those events and target question answers for them. And, you know, be their comfort zone to talk about what they were going through or a relative was going through. And, one time I was in the audience with someone else and I told Dr. Underwood, you know, there's something strange that's happening here. These questions that a friend of mine who had moved to Indiana and wanted to know if we would do what they were recommending in Indiana, would we do that for her with the particular type of breast cancer she was diagnosed with? She wanted to know. And so I had that in mind. The pursuit of answers, but you know what? It's just split. I'm not asking for her, I'm asking for me. And that's how I knew, you know, it was just this intuitive gut thing. And then that's leading to why we collaborate to empower young Black women who are under the radar. They have this gut feeling sometimes, they get turned away. You know, and it's sad and it's wrong. And then they come up in the cancer process as stage 4 with interrupted lives and completely livelihoods. And, you know, defeated at such a young age, you know, with stage 4 disease. So this is why it's important for this type of work for all types of health disparities to occur at this level to empower others. And I'd like for everyone who's in here as a member of one of the 5 collaborative work groups to stand up. Please do. To look at health disparities of their region and try to really flip the script, so to speak, and change things and empower the people who were facing such enormous barriers to be more self-sufficient and able, because they knew someone had their backs, that we knew about them and that we cared about. So that type of collaboration,
Just hit the button on the right.
which one is it?
It's the right arrow. Just hit this one to advance. This in. There you go. Go to the next.
Okay, leads to this activity. And so you guys, you have question 1. And I'll give instructions in a minute. And you guys here, you have question 2.
This row.
Mhm.
Tables.
And so just this row. And then these last 2, you have question 3. And so this is an abbreviated activity. Some will be presented and you say, I say it's OPAS, but to depend on collaborative working and cooperative learning skills would be essential for the type of work that we do. So this is just a small participatory thing, looking at what we call ourselves collaborators for you all to go through with us. And so what you're going to do is talk to your shoulder buddies, both at your table. We're only going to take an answer or 2 from each of the 3 groups. And so that's why we're on the floor too. We're going to come and do it, right? So don't be shy, okay? And so go ahead and talk about your question, okay? And we'll be right back to you.
Oh.
Lack of spirit. Right, like, if you're about 9, it's like, I want to raise as many dollars, my about $6 to serve. That's like. Right. Yeah. But this is like, you know, and it's to like, that's collaborative. Get us together and make it funny time, like, opportunity and feelings are, it's like you, it's, I don't have time. Relationship with your collaborative. Yeah.
So we've given everybody about a couple of minutes so far, we're gonna go ahead and get the entire crowd. On this side of the room, is anyone willing to tell us about what they would consider what is collaborating? So this lovely table over here says collaboration, bringing resources together to serve the community, especially those with limited or lack of resources, as well as connecting personal experiences to the voices and stakeholders to bring education. I think those are really great answers, yeah. Okay. Move over to question 2 on the middle area of the room.
Anyone would like to offer their comments on what hinders collaboration? I'll share. Yes, please. Would you like the mic? Sure. There you go.
A couple that we came across in our group was time or priority. Funding, you may have great ideas, but you don't know how to pay for it. How do you know how your priorities fit together, like looking at the bigger picture? Another thing would be coordination, an example of maybe different organizations not being aware of what other organizations are doing and hosting events on the same day, when it could have been a collaboration with coordination. So these are just a few.
Outstanding. Great, thank you. See, we can do a lot, say it and pack a lot in only a couple of minutes, right? Yeah, great. What hinders collaboration? Outstanding. How about the next section?
Okay, so question 3. I see the answer here.
What drives collaboration?
Morning, everyone. So, we have a few things, willingness and openness to collaborate is one of our collaboration. Alignment with the cause of everybody that is with the cause, they have some type of investment in the outcome. That the collaboration is occurring within the community that is supposed to impact, so it's not, we're talking from outer space and the people are on earth that we need to impact. Inclusivity and then psychological safety, so we need to have a safe space to talk about our ideas. There's no dumb question, there's no dumb, everybody's part is important.
Thank you so much. Is there another one willing to offer an answer to what drives collaboration? Yeah. I see you pointing to the way you do.
Most of ours were shared, but we had shared goals, shared vision, passionate people that are wanting and have that fire in their belly to make a difference. I think it's really important to have those people steer you. Resources that you can pull together and just that willingness and desire to work together, not be in your own lane, but being willing to merge together.
For the middle question, I just want to add from our process, something that we learned that was very valuable. And so at the end of phase 1, we have to set a ground rule regarding decision making. Okay, because zealousness can hinder. And you know, everybody has a great idea. And the biggest personality sometimes they push their idea more than someone else. And you can get veer off to the right or left and forget where it's supposed to be. So we drew up a decision-making process and talked about it. And, you know, agreed, you know, that we had recognized in ourselves is a tendency and had to draw back from it. Because if we would have veered off and stayed off track, I really would have hindered on our purpose.
Great, thanks everyone for offering your thoughts about what is collaboration, what drives collaboration, what hinders collaboration. And Phyllis teed up a little bit about what we're going to talk about in a moment as to the work of the collaborative work groups and the purpose of that work in helping to identify solutions to specifically breast and lung cancer disparities in Wisconsin. What I'd like to do is just give a little bit of background introduction on the Community and Cancer Science Network, what the collaborative work groups are, and then for the next portion of our time, we'll talk about how the teams came together and how it's influenced relationships and our progress forward. And I appreciate that what people have offered as far as what hinders and drives collaboration, because those are the things that are sort of the meat and potatoes of this work. And the things that the work groups sort of move through themselves in trying to identify solutions. And it's outstanding to have work group members here as well that we know can speak to this very much firsthand. So the Community and Cancer Science Network, ccsnwi.org, I believe is the website if you want to also look it up. It's really about understanding the ways in which we can utilize transdisciplinary partnerships to address cancer disparities. We know that quite unfortunately, there are a lot of complexities that underlie what can cause cancer, but then it also means that it requires probably some more complex solutions, right? So when we think about the causes of cancer, it can be anything from genetics, it could be tied to access to care, it could be tied to social or behavioral or lifestyle, issues. And because there's a number of things that can contribute to cancer, it forces us to think through more deeply, what those solutions might be. I really appreciate Coach Card's opening statements around what is your why. I think about that a lot in the work that I do around community engagement and to this work. I, like many others in this room, have that connection as a caregiver as well. So it's really helpful to think about the complexities around this work, and the work groups have really been pivotal to that. There are some key principles with the CCSN, and that includes deep equity. So thinking about, and we'll talk about this as we discuss the work groups, but deep equity as far as not only just health equity, but even who's involved in the work groups. So when we think about the composition, who's in the work groups, it's not necessarily the first individuals that might come to mind, those that have an assumed level of expertise. It's also about those that bring different perspectives to the work. And that's what's really critical, including those that have different, not only different perspectives, but bring their own voice, their own lived experience, for example. So deep equity being one of the principles. Also around systems change, which I'm sure many folks in this room can appreciate, recognizing that in order to advance this work forward, it can mean really looking critically at our existing systems. What might need to change? What do we need to examine further? And how do we advance that in our work and in identifying solutions? And finally, the integration of biology to policy. So basically that means thinking about the perspectives and the expertise of individuals that everything from the basic science, and you might be familiar with the term from bedside to policy, thinking about how can we advance the work from a literal cellular level to true policy change. And we know everyone in this room, we're all advocates perhaps at heart, and can appreciate how we need to advance the work. Just to give a visual picture of where the work groups are situated in their activities, we have 5 work groups across the state, or in phase 1. This work was in 2 different phases funded by the Advancing a Healthier Wisconsin Endowment. So we had work groups in Milwaukee, Racine, Walworth, and then with our partners, Lac du Flambeau, with the Great Lakes Intertribal Council. So what's key here is that we were focusing on breast and lung cancer disparities, and we had what we called our community champion partners. So that included, as I said, the Great Lakes Intertribal Council, the Wisconsin Women's Health Foundation, and the YWCA in Milwaukee. And our process was, it looks rather simple on the slide, but I'm sure as folks here know that collaboration is not as linear and direct, but for the purposes of the slide, that's how that's our process. So it started in phase one, which was about a two-year phase. We had 18 months of funding that we extended through a no-cost extension. And the process included with the work groups that were comprised of individuals that had clinical expertise such as Dr. Cortina, individuals that had lived experience, advocacy, expertise such as Ms. Holder, and anyone else that was somehow tied to this work and really had a vested interest in addressing breast and lung cancer disparities. So the first part of the process was really for groups to be able to just observe and understand. So what does that mean? Trying to understand the root causes of cancer and cancer disparities. Now, for some that may seem obvious what those root causes are, but we found that, and this will come in the slides ahead, but you just peel back the onion layers, if you will. So you can ask questions about, well, is it tied to lack of access to care? Well, why does that exist? And keep asking why, peeling back layer after layer, and recognizing that in order to get to the next phase of our work, which was tied to identifying solutions, we had to really understand the different layers of the root causes. And I'll note that each of the work groups had a facilitator and an evaluator. I believe our facilitators and evaluators are here, so I'm gonna call folks out to raise your hands. Our wonderful Jada, Felicia. Any facilitators and evaluators that of course are very modest, but you know, can't let folks go unrecognized for the important work that they did. So guiding the groups through this process included observing and understanding. Then a discovery and digestion, if you will. So really an extension of that and thinking, okay, if these are some of the root causes, how do we best identify the potential solutions that can get us to addressing some of these underlying causes, and then ultimately designing solutions. I appreciated Phyllis's comment around, you know, how do we best do that? There may be solutions that are outstanding, but they may be in the stratosphere in terms of what is feasible, fundable, et cetera. So we're now at the next phase in our work, which is really helping to advance some of these identified solutions moving forward. And with that, I will transition back to Phyllis for talking about your own perspective, being a collaborative work group member.
Now, it looks kind of blurry, I'm not the best photographer, and that may have been so that she wouldn't turn and grin. But that's my granddaughter, Ryan. And I was very, very fascinated to watch her, and she was probably 16 months old. Isn't that working? Kind of, sort of? Okay, but to watch her talk to her doll about what she knew about flowers. And so she's having her doll smell the red flower. And she's offering it up in all her knowledge to include her doll in the world around her. And so I have both hands. I'm sorry, so I need to, so the next one is to show that I realized that I had a little scientist on my hands. She had a rock seeking pattern that she used every time. It wasn't good for any old rock. Okay. She had a stick in one hand. She'd find her perfect stick. And then she looked for the rocks that she wanted to tap. And it had to tap just right for it to be the rock that she would take home from that particular fall. And I tell you that and I share that because as a volunteer, that was over 32 years ago. You know, when I went to help people come to get information, my daughter was a newborn. Well, she's 30, well, it's more than 30 years ago. But she was a little girl, and she too had to go where I went to different activities in the community. And so it must be some kind of ritual so has this child. And it just, she and my daughter and my middle granddaughter, my oldest granddaughter, they remind me constantly about how the world is at rest. And that it's up to us to do something. Okay, and so I'm showing you my wife. Here's this beautiful child. What kind of future will she inherit if we keep doing the same old, same old? You know, what kind of future? And so that is why I start off with showing you my grandchild. Backwards, it's okay. Turn it over, Phyllis, let's see. Okay, so now this particular slide. The date is significant, May 23, 2023. The Milwaukee Collaborative Work Group probably started around the same time in 2022. And so that was when we developed our work patterns, you know, our flow, ebb and flow of the mixture of people in the room, and got to know each other pretty well. And, you know, had to decide, how could we come up with something innovative in a room that really wasn't a room structured to be safe. It was a room that was structured for us to be bold. You know, the sky was the limit. And then that's how we found out we had to put bumpers on it. It wasn't a safe place, but we trusted each other and respected each other and had true compassion about what we decided to do. And we decided to take up the cause of young Black women, okay, facing so many disparities regarding breast health. And so meeting May 23rd, 2023 was a point where we had come together multiple times, and we used Basecamp as a communication tool. And, you know, we met online and we met in person, and the recorder and, you know, as a facilitator, and Kaylee as our design facilitator for Group Flow. You know, it was just, and the food helped, but we had a good time in meeting, okay, to be able to work with people. And there were no, you know, big eyes and little U's. And I'm right here with Minerva. I remember telling Minerva, you know what? It's nice for Toby to drop in and see us. I had no idea she was the boss, okay? Whatsoever. What is she doing here again? But so it was just a remarkable experience because, like I said, I think I had become jaded after 19 years. And then if I'm going back to 30 years ago, maybe treatments have advanced. Okay, beautiful therapies have developed and bloomed over the years, but how to treat the person behind, you know, affected, the family going through the cancer experience, that hadn't changed much. And this, well, it doesn't look like it did on my camera phone, okay? But imagine that sky back there is cloudy, but you can see hints of blue. And then the water back there, you can kind of see some blue. Well, that's upstream. Okay, and then you get further down the photo and it gets muddy looking and it gets all murky and there are rocks all in the pathway. And we happened upon in that year from May 2023, 2022, 23 on a theoretical background or foundation of upstream. you know, to what can we do to make more, we need to move upstream. And so coming to be in public health literature and true strategy and not just words, you know, about why things happen the way they do, because nobody's working at the root of the problem. They just want to fix it at the tail end. And so if this just to say that we wanted to be bigger in our impact to impact community-wide versus an individual seeking treatment. And the only thing we had was faith. That as we sat there and planned, that what we were talking about made sense. And that we could do it, we could actually implement the ideas that we committed to paper and to discussion in paper and then as our final project. Now this feedback, now this actually took place in the community around October of 2023. And so these were people, maybe some of you in the room, that from other organizations invited to look at our end product. So from May to October, you know, we really brainstormed and did this cooperative learning and collaborative work to come up with our project. And we wanted to show it off and get feedback. And so the posters were on the wall and we circulated and talked and structured a talk where people really truly had to answer a question or two and give us an idea of were we flaky or were we really for real with what we had designed. And then just again, that there had to be some tactics and some strategies for us to be able to call ourselves moving upstream to affect change. Okay, let me go back. So for me, exploring, you know, well, I'm so excited about doing this again and, you know, pretty much came out of retirement. Excuse me. Came out of retirement, thank you, to do this and, you know, I have to explore more. And so in the world of business, this is a best-selling book that people who want to change communities and businesses to impact community, they're looking at how to move their efforts upstream too. And so this book is a bestseller and it's how it made my slides. Because I flipped through it and you know it kind of made me become a believer. And this is our leap of faith. Okay, and I'm blanking on the date. But by then we had gone through root cause analysis and put together our solutions, the barriers, the things that we were going to work on and put the solutions in place. And we again wanted people from the outside to come take a look and hear us and help us see if we had put everything in place that needed to be, or do we have something extraneous? What can we do to do better? So this is at Turner Hall. And I believe about the same amount of people. And everyone did, unbeknownst to them, they got an assignment in the room. And, you know, they had to write on Post-it notes or do drawings or do this or do that to put what they felt about what we put before them to give us some appropriate feedback. And so we want to make sure we move beyond the data and have something that was clean and usable before we move on to the implementation phase.
Phyllis, if I could just make a comment about that, because this was such an outstanding day that we had. I think it was about 75 to 80 participants. We did a World Cafe style This May of last year, and the World Cafe style, if folks are not familiar, you're in a setup similar to this where people are at groups and tables. And we asked individuals to just sort of reflect openly about these given areas tied to social factors, treatment, insurance, screening, things that had already evolved from the groups. And then people just sort of rotated through and wrote their ideas down. And as folks are reporting back, we had a graphic artist that was mapping this out, how people do this. This is pretty amazing to do this in real time. But we had someone that in real time to sort of map this out after hearing the conversation. So it's sort of an enduring product that really speaks to the process and the discussion that we have. So thanks, guys. Please go ahead. We'll share, and we'll share the slides too. We're happy to share anything that we have here.
So I'm a clinician, I do some clinical research, and I had never worked in a collaborative work group before. I wasn't really sure what the CCSN was gonna be about. I had kind of been poked by Melinda Sally to consider joining one of them, and I was like, sure, we'll see how this goes. And wow, was it an eye-opening experience. Being in a room with cancer survivors, community members, people that don't work in hospital systems, it gave me a totally different perspective about how to approach problems, how to think about clinical research and medical care in this modern era. And so I think as clinical researchers and as clinicians in general, these collaborative work groups can have a pretty profound impact on how we think about things and how we ask questions and how we design studies to try and solve a lot of these problems. I think we just have about a few minutes left, so I'm gonna kind of go through this pretty quickly. That way we have plenty of time for questions and answers. But our groups meet virtually and in person, sometimes hybrid approaches, in this era of COVID. And that also enables people from around the country to participate. One of the newer teams that I'm on right now, we have a team member who actually lives in Portland, Oregon, that's able to join us because of this hybrid format. And so that lets us bring different voices and different thoughts outside of just here in the Milwaukee area, but lets us get people from around the state. And sometimes from different places of the country who have similar interests that we do. I worked initially on the Milwaukee breast cancer work, and then through some more collaboration, more thinking, I thought, well, how can this sort of community cancer science network work in different spaces outside of breast cancer and outside of lung cancer? And we were fortunate to get some funding from PCORI to expand this sort of work and framework to look at cancer disparities in trans and gender diverse populations. And Phyllis showed a great graphic at the end there. It's like a nice cartoon, but to get there, it's messy. It takes a long time, it takes a lot of thought, it takes a lot of different perspectives. And so to kind of give you guys like the mess that goes into making the pretty chart, we did some root cause analysis of our own. And this was kind of what our group came up with. Right, complicated, messy. Yeah, right. This would be organized version after it had gone through a few different cycles. And then, our group wanted to make sure that we weren't missing any perspectives. So we went outside of our group and said, let's talk to researchers, let's talk to community members, let's talk to trans and non-binary patients, let's see if we're missing stuff. And so, after we did that, we did these dedicated discussion sessions with a lot of other individuals. And it got even more complicated, because you realize that we missed some things. And so I'm just showing you guys this because this process is pretty complicated. And whenever we think about all these different things, and we start thinking about solutions, we use things like the feasibility model to decide what actually makes sense for us to ask. What is actually feasible to do that we can do from a financial standpoint, from a time standpoint, with the personnel that we have. And so there's a lot of complexities that go into this work to make this really profound change. And I'm really lucky to be a part of this. I came in sort of the past couple of years, and we're really meeting on the framework that people like Dr. Youngs and Dr. Sally have put into place over the past few years. But it's really exciting work, and it definitely gets us to think differently about how we approach problems, about how we answer questions. And our whole goal is to really lead to actionable research questions that can affect biology, policy, and ultimately positively impact patients. So I think we're gonna take some questions now, if there's Phyllis, you wanna say something else?
But if you don't mind, and if I can hold up the questions just a second here, I want to tell you that we're delighted to be in phase 2 and that's the implementation. And we partner with some wonderful community people and organizations. And what is part and parcel of what we're doing upstream is that Progressive Healthcare organization and Planned Parenthood have added community health workers, one each, to their staff who will be breast care specific. And they've added an assessment to their intake to bring up the red flags for any young Black woman, African American woman under age 40. And then that's in the referral to breast care specific person, community health worker, that's when it starts. And we also looked at law. And so we partnered with other groups in support, because we can't lobby, but we're very much some individuals in the background of supporting Wisconsin State Senate Bill 121 that would guarantee the payment for supplemental screenings like MRI and ultrasound for suspicious mammograms, or now as it is mandated, mammograms that say you have dense breast, increased dense breast tissue. And then it goes period, but it doesn't tell you what to do. So we're trying to upstream that too. Okay?
Moments for questions, if people could write down any questions and Beth can select. And while that's happening, I just want to make sure in the spirit of collaboration that we don't miss acknowledging anyone. It's been a pleasure for me to be a co-lead in this work. I'm the co-lead, and the other academic partner in this work is David Frazier from Center for Urban Population Health at UW. So I think one of these acknowledgement.
Okay, the first question is, for collaborative work groups across the state, do you have shareable results about what you've discovered, or publications, or ways that people could learn what you're discovering and kind of use it in their work and trying to do these collaborations in their communities?
Great, thanks for the question, Beth. And great timing, because today, during the, we have a poster session later, and we have posters for the work groups that are set up. So that's a great visual that demonstrates some of the findings. And we've had an opportunity to share the results nationally at conferences such as the American Association for Cancer Research, their health disparities meeting. We've shared our findings there as well. Still moving towards ultimately a publication stage, but taking any opportunity we can, such as venues like this, to share some of the findings. So please look for our poster later today, and we're happy to talk about what you see there as well.
And we're good.
Great. Thank you very much.
Opportunity to thank our panelists for their expertise and their work, please. Beth asked me to share with you before we continue on that if you want the Wi-Fi